My name is Najjuko, and today we have Dr. Moustafa, who is joining us on Vital Conversations, and he will basically give him the floor, basically to introduce himself, and then we can dive right into the questions that we have crafted for him today. Doctor, please introduce yourself.
Thank you, Naj. It's my honor being here with you today. I'm Dr. Moustafa Abdelwahab. I'm a dentist by education. I have a master in healthcare quality. I have diploma in public health. I'm an HI fellow, working as a senior specialist in quality improvement in the Department of Health in Abu Dhabi. I have a long experience working in Egypt, Saudi Arabia, and
now that you've given us a brief introduction of who you are, we break our podcast into little sections, and the first section is usually trying to break the ice and get to know you a little bit better. So okay. The first question what we'd ask is, what first sparked your interest in the areas of quality and patient safety in healthcare?
The main interest and the main thing that led me in this field that I believe that patient safety and quality is everyone's responsibility. Some people who is working in the medical field think that the responsibility for the patient safety is for the physician only. And then from other people's point of view, it's the nurse only. However, it's everyone's responsibility. It's the physician, the nurse, the allied health, the admin, everyone who's working in the medical field. It's his responsibility for this patient safety. It's like a circle, and everyone needs to do his role to achieve the good quality and the patient safety. This is the main thing that led me to think how I can improve this environment, this circle, and to work with hospitals, with healthcare providers to improve this.
Well, that's quite interesting. I can feel the passion basically in even how you've answered your question. So if I were to say, what's one thing that most people may not know about the work involved in ensuring quality care and patient safety?
So simply, when a mistake happens or there's an error happens to a patient in a hospital, for example, a medication error happened to a patient, they start to blame the last part of the chain, which is, for example, the nurse itself. However, there is a chain of errors that's led to this mistake or this error, which led to harm of the patient. People think that the nurse who did this or the last part of this chain is responsible for that. However, no. There is someone who prescribed the medication, there's someone who dispensed the medication, and there's someone who gave the medication. So these errors pass through many holes in the system, which led at the end to the harm that led to the patient. So when we're going to fix this, people need to know that we need to fix it. We need to make something called root cause analysis. We need to start from the beginning, why he did this. So we need to ask ourselves many whys, why he did this. Nobody in the healthcare sector needs the patient to get harm. So if we are human, and human do errors. Our part or our role in the hospital, in this organization, is to eliminate this error, which may affect the patient. Let me tell you something. As per the last research, that medical errors lead to the second cause of death all over the world. Maybe there are some errors that reach the patient, but we are not aware about. Our role in the organization is to catch these errors, even if in two situations, whether it reached the patient or didn't reach the patient. So we need to work with the providers, with the frontliners, to know where is the gap. Maybe maybe the physician is working more than 8 hours or 12 hours. He's overwhelmed. He's monitoring many patients. Maybe the nurse is monitoring many patients. Maybe there's something called look-alike, sound-alike. There's some medication who is with the same name. The nurse took the wrong medication. Maybe there's no label. Maybe the patient didn't give a right history, so I didn't take a right history from the patient, which led to a harm at the end. So people need to know simply that it's not a single responsibility. It's everyone's responsibility.
Mhm, mhm. In that case, when you mentioned that there's obviously somebody who administers the medication, there's quite a few people in that process, right? Now,
Yes.
is there a reason why there's many people in the process, or would minimizing the amount of people cause more damage?
The healthcare environment is very complicated.
Mhm.
I will give you an example. If I ask you, which would you prefer or trust, a robot to do a surgery for you or a human? What would be your answer?
Oh my. Well, to be fair, we tend to put more trust in human beings. But I mean,
Exactly.
with now day and age, the way they're trying to convince us that because the human has created the robot, we can trust that the robot can do the same job.
Exactly. That's right. However, in some complicated cases, we
Hmm.
don't trust robots.
Okay.
Even when on the airplane is landing or taking off, so there's a human interference.
Yes.
We trust human more. However, human do errors.
Yes, true.
This is the point. This is the point. I trust human. I know human may do error. Everyone can do mistakes,
Hmm.
but we need to eliminate or to reduce these gaps. It's like a Swiss cheese holes. Do you know the Swiss cheese? So
Yes.
there's many holes. The point is you need to put like a gatekeeper on each hole or each gate, so you
Ah.
eliminate this.
Okay, okay, okay. Oh, that's a beautiful analogy because it makes sense. I mean, it is one element, but in order for it to function, there has to be someone everywhere.
Exactly. Let me tell you something. One of the stories that I was a part of this investigation, there
Mhm.
was a patient in a maternity hospital. You know how we identify the patient inside the hospital. So we identify him. We have two identifiers or three identifiers. For example,
Mhm.
uh, Muhammad Ahmad Saeed. So when I am trying to identify the patient, I need to identify him by his three names, date of birth. I cannot identify the patient only with names because maybe my name and your name is the same.
Yes, true.
In some countries and some cultures, the first and the second name is almost the same. Muhammad Ahmad. So it's the same name. What happened in this hospital, it was a maternity hospital. And
Mhm.
then um, there was one patient, let's call her name is Suad Ahmed, for example, it's just any name. And then this patient was coming as an elective for C-section, coming elective for delivery.
Mhm.
In the same time, there's another patient who came to the emergency with the same first and last name. And then the first patient who was coming as an elective, they deteriorated, and then they requested to send her from the vaginal delivery to the C-section, to the ward. In
Mhm.
the same time, another patient who have the same name, they sent her from the ER to the OR. And by accident, not by accident, by chance, the same nurse who transferred that patient from the labor room to the OR transferred the same patient from the ED to the OR. So we have two ORs at the same time. The first one with Suad Ahmed doing C-section, and the second one in the same time, Suad Ahmed is doing a C-section.
Mm.
But everyone with a different physician.
Okay.
The second patient, her blood group is O. The first one is AB.
Mhm.
The second patient had uh, internal hemorrhage, and she was the bleed. She was there was a bleeding in the patient, and then they requested to transfer a blood. So the second physician went by himself to the blood bank requesting the blood for the patient of Suad Muhammad. Then he told him, the blood bank technician told him, he didn't make the identification that time. He
Mhm.
told him, here's the blood for Suad Muhammad. But, and he stopped for a while. He told him, you are requesting for Suad Muhammad. You are telling me her blood group is AB. However, this one is B, for example.
Mhm. Mhm.
But let me check in the system. And he checked. He found Saab Muhammad with another blood group, but he told me, okay, here's the blood group. Please take it. The physician took the blood group to the wrong patient and gave it to the nurse and told her, give this blood to that patient. The nurse know that this patient is, for example, it's an AB and
Yes.
the other one is B.
Yes.
However, she said, of course, the physician is not wrong. The technician is not wrong. I'm going to follow the order. And
Mhm.
she start to give the wrong blood product to the patient. And she knows it's wrong.
But
But she said,
because of authority, the ones above her cannot be
exactly,
wrong.
exactly. The patient survived after that. She was given 40 antidotes to survive her. But the question is, whose mistake is this? It's the nurse? Is the physician? Is the technician? Whose responsibility? It's everyone's responsibility.
Yes.
So these story can tell you there's a chain of errors.
Mhm.
Again, it's all about communication.
Mhm.
The last example I can give you, there was someone who has a, let's say for the Christmas, and then he asked his mother to make it shorter 2 inches. But the mother told him, sorry, I am busy. Then he went to his sister and told her, please make it shorter 2 inches. She said, I'm busy. I'm not going to do it. Then he took the pants to his friend, and his friend make it shorter 2 inches, and then he put the trouser inside his locker. While he's sleeping, his mother came and she took off the pants and she make it shorter 2 inches
Yes.
and she put it
Right.
in the doorway. Then his sister came back and she make it shorter 2 inches. Next day, when he wear the pants, it become a short.
Yes.
The question here, whose mistake is this?
I mean, it's a lack of communication at the end of the day, right?
Exactly.
Yes. Yes.
Exactly.
Mhm.
Everyone did his part. The mother did her part. The sister did his part. He did his part. However, because there's no communication, he didn't say, I did it. No one do it. Please stop.
Yes.
So for that, there was a chain of errors. This is the same thing that's happening in the organization.
Okay.
Maybe there's an error during, or there's in the count during the surgery, there's a missing part. You need to speak up.
Mhm.
And this is very important part, to speak up. Stop. There's something wrong.
Mhm. Mhm.
Let's recount again.
So basically, in the scenario that you gave, even though the nurse knew that the blood was incorrect, better she says something, regardless of if she believes that her higher counterparts are correct. It's best that she
Exactly.
check just to say, are you sure that this is the blood that we should be giving to the patient?
Exactly. When we investigate with the nurse,
Mm.
she said, yes, I know. I gave the wrong blood to that patient, but I said, the physician, the consultant, give it to me by himself.
Mhm. Mhm.
So who knows much better, me or him?
Mhm. Mhm. No, that makes sense. That makes sense.
Again, it's not the physician role to go and get the blood. There was a gap because the circulating nurse was not there. So there was a shortage in the staff that time. So what I need to say is
Mhm.
it's a chain of errors which lead to a patient harm.
Mhm. Mhm.
Let me ask you one question.
Mhm.
If that nurse, let's go retrospectively, stopped and said, excuse me, this is not the same blood group, do you think it will reach the patient?
No.
No. If the technician said, excuse me, I have two patients under the same name, can you please give me her MRN or date of birth? That will stop it.
Mhm.
So, as I told you, it's like a Swiss cheese model.
Mhm.
Everything, the mistake or the errors pass through all these holes.
Mhm. Mhm. No, that's very true. I mean, at the end of the day, just her causing the smallest doubt would have to make the entire team first make that double check before they put the patient at risk.
Exactly, exactly, exactly. And the point is, the most important part here is you need to declare there's something happened to the patient.
Mhm. Mhm.
Because if you hide it, so another mistake will happen to the patient. Even sometimes when the physician prescribe a medication, for example, he may use some abbreviations. He may use pen make zero. So the nurse can see it as 50, not 5. But she can stop for some time. I cannot give the patient 50 insulin, I can get, it's only 5. So let me call the physician and make sure. Or maybe she's going to give him 50. So again, it's about communication. It's about stopping the error. It's about speak up. Our role is to do this. Another part, which is we always say, if you cannot measure it, you cannot improve it.
Mm-hmm.
For that, it's very important to have a KPIs, key performance indicators, to measure the performance for everything. You need to measure the structure, the process, and the outcome. Mm-hmm. And then you need to drill down to the outcome per physician level to see what's the performance, why this happened. At the end, the culture should be 2 things. We need to improve it, and it's a non-punitive culture. We are not here to blame anyone, to punish anyone. We need to improve it so the harm will be eliminated, so nobody will be at risk when hospital, they are in a safe environment.
Mm-hmm. My question, basically, following up to what we're discussing now, in the medical industry, do you ever follow the concept of if it's not broken, don't fix it? Or are you always saying, regardless of the situation, we always want to be better than what we were yesterday? Because I'm sure you've heard the saying, if it's not broken, please don't fix it. So how did the medical industry respond to that particular statement?
Yes, it's a very good question. When there's a service provided, as I told you, it should be monitored, because if you cannot measure it, you cannot improve it. Mm-hmm. So we have each healthcare facility should have a set or a bunch of KPIs that measuring the process and outcome. There are 3 things needs to be clear for everyone. There's something called international benchmark based on the evidence-based. Mm-hmm. There's something called internal benchmark based on our performance. And there's something called target. For example, if I said that the patient satisfaction all over the world is 85%, and then this is international benchmark based on evidence-based, based on high HROs, high reliability organization performance, and then I say that my internal benchmark, my patient satisfaction is 79%. Mm-hmm. So this is my baseline, international benchmark 79. My internal benchmark 79. My international benchmark is, I said, 85. So I need to improve the 79 to reach the 85. I'm going to set a target. I am going to fix it. So I cannot ask the people who are in 79 to reach the 85. Nobody can jump this. Mm-hmm. So I'm going to put a target, 10 to 15%. So I'm going to ask him, this 79 needs to be 82 or 81 by next year. And then this 81 needs to be 83. And the 83 needs to be 85. So not because it's broken, I'm going to leave it. Or if it's not broken, I'm going to leave it. I need always to improve. Even if I am reaching 90, I need to improve it. The improvement is not just to achieve the 100%, but it's to sustain improvement. There are some KPIs or some performance measurement called international patient safety goals. Mm-hmm. These international patient safety goals, it's patient identification, hand hygiene, patient fall. If I am achieving some hospitals are achieving 95%, 99%, 100% in patient identification. So when we go to them, they will give you a sheet that we are achieving this 100% since 2-3 years. Does it mean that we stop monitoring this? The answer is no. You need to keep it, because it's easy to achieve the target, but it's hard to sustain this target. Mm-hmm. So sustainability is very important. And again, we advise providers, if, for example, your identification or your KPI is measuring on 100%, you can look to the same KPI in a different way. For example, if you're looking to the patient identification during blood administration or during examination, why don't you look to the identification during serving the food to the patient? Maybe there's something wrong during patient identification. Maybe the one who is providing the meal to the patient is providing a wrong meal to a diabetic patient. Did you know that there's an identification over there? It should be. So why don't you measure it? We are always asking people, don't be in the comfort zone. You need always to challenge yourself. You need always to sustain improvement. You need to look where's the gap. There's a lot of things that can be improved in this complicated healthcare. So please work with us, do the improvement, sustain it, and do an action plan to know where's the gaps.
Now that you've actually mentioned that basically you have to work together, my next question basically would be, what are some of the best practices for fostering collaboration among the healthcare teams to ensure that patient safety is always at the top priority?
So I will tell you what's the best thing that is done right now. For the patient safety. For example, let's say in any country, there are 60, 70 hospitals. Everyone is operated by different people. And then there's a mistake that happened in this facility and they try to manage it. There's another mistake happen in this facility, they can manage it. However, maybe the same mistake is happening on the third facility, but they are not able to manage it or they didn't see it. The best way ever is to gather these people on a weekly, on a yearly basis. And then everyone can say his story, what was related to the patient safety. For example, he say, I have a good catch in related to the patient safety. There was an harm going to each patient, and I did 1, 2, 3, 4. Then the other one is going to listen and see how we can improve his system. The third one can say, by the way, I have the same issue, and then I fix it that way, 1, 2, 3, 4. So conferences, sharing knowledge, patient safety journals, and webinars. There's a lot of way to share knowledge and experience between healthcare providers because nobody is perfect. The errors that happen over here, there's someone who is in another place in the world who solve it and can give you the solution that way. So we always encourage facilities to do this knowledge exchange. We do two things. There's something called Patient Safety Week, which is these days. There's a Patient Safety Day, which is September 17, every day by WHO. During these events, we are trying to gather hospitals, providers, and tell them, please, everyone, share his best good catch. Share your role in the patient safety, to share knowledge with the other so I can learn how can I protect my patient. For example, we are always encouraging facilities to share their performance on the websites. Please share it. Please let the other to see what did you reach, for example, for the readmission. How did you eliminate the readmission? How did you eliminate the no-show? Patient who are coming, who is having an appointment in your clinic and they don't come. How did you fix it? So sharing knowledge, evidence-based medicine is the best thing for patient safety and to have good quality of patient care.
Amazing. Now, having said that, when you're measuring the quality and the safety of the outcomes in the clinical setting, what metrics or systems do you do to rely on this? I mean, from what you've just explained, I think it's amazing that obviously, like the conferences that you mentioned, because maybe in this region, they're experiencing X. And then in this region, they're experiencing Y. So Y might not have ever come across what X had gone through. So obviously, meet at the conference, then you're able to say to each other, we've never experienced that, but it's great to know. So in case that does happen, we would be able to follow suit because you've at least proven that that particular solution works. So is this part of the metrics building system, or like how do you generate your KPIs, let's say?
So, as I told you, the healthcare system is very complicated. Some facilities, so in some countries, the government owns the public hospitals. In some other countries, there is no governmental hospitals. It's all private, but monitored by by its ministry or Department of Health.
Mhm.
So it depends. But at the end, the regulator in each country plays a crucial role
Mhm.
to improve the quality and patient safety.
Mhm.
Their role is to have a quality committee all over the country or all over this region to share knowledge and work with them proactively, because there are two ways to work on any incident. Whether you work retrospectively, for example, a patient died, and then we start to make a root cause analysis why this happened, and then we solve everyone retrospectively, or to work proactively. So if we know that we have 3, 4, 5 cases, we need to work proactively to eliminate this error. The good system is the one who works proactively rather than work retrospectively.
Mhm. Mhm.
All the government play this crucial role to improve the patient safety. They gather the people, they have a committees. Even on the hospital level, each hospital have something called mortality and morbidity committee. But the point is, some hospitals they don't know the important how important this mortality and morbidity committee. There should be some triggers. What is mortality? Mortality is very clear. Mortality is the patient who dies. So any patient dies in the healthcare system, they should analyze why he died, and if there's any way to eliminate this error which may happen to the patient. But the morbidity is there's many triggers for the morbidity. Maybe the patient fall is one of the morbidities. Readmission is one of the morbidities. Hospital acquired infection is one of the morbidities. So the point is they need to catch up. We always encourage hospitals to have electronic incident reporting system. So anyone can put an incident. For example, this patient fall. You need to speak up and say these patient fall. In one of the systems or the stories that I read from or I heard from one of my fans, that a patient fall from his chair during the night shift of the nurse. When the nurse go inside, she saw the patient fall, and then she helped him to sit on the chair, and the patient had a fracture, a femur fracture. Because she didn't speak up, the patient had this fracture till the morning, till there's an infection happens, and this infection led to leg amputation. They
Oh,
cut his leg. Because she didn't speak up, she said, no, the patient didn't fall. But if she said she was afraid, but because of her fear, the
yes,
patient had a big morbidities. So
yes,
we always encourage facilities to do two things: non-punitive culture, just culture, and also do something called patient safety culture survey. We need to work with the hospitals uh, to improve the patient safety culture. Providers, frontliners need to be able to speak up. I am able to say what happens. I can say I did a mistake. Everyone can do a mistake.
mhm, mhm.
So the metrics that they should use, there's many tools. There's an IHI tools. There's patient safety culture. There's an incident reporting. There's an equality performance. They need to have a dashboard. They need to have an KPIs to monitor it. They need to follow the best practice. They need to speak up. They need to sit with frontliners to know what's happening on the ground so they can solve it. These committees needs to have really an action plan to eliminate any error that may reach the patient in the future.
With what you've just mentioned with regards to, let's say, the nurse obviously not speaking out, and then obviously that causing the patient to be amputated. I think my question would be, what are the consequences for the nurse herself in that particular scenario? And let's say you do try to enforce a patient care culture within the industry. Like when the person does say, yes, the patient did fall, how would they address the nurse? Like, what would make her feel safe in order to tell the truth? Like, are there particular consequences that she would feel afraid to tell the truth?
Yes. This is a human nature.
Mhm.
So everyone don't like to say I did a mistake
Yes.
because they may punish me, they may cut my salary, they may kick me out of my job. I have a lot of responsibilities. But if I let the staff, my staff, to feel that everyone can do a mistake, and please, your role is to take care of the patients. You need to feel that you are here. Don't be afraid. Please speak up. This will take a lot of time. The best patient safety culture survey done was in the United States with the score 70%. So that means 70% of the staff who is working in the facilities feel that the patient safety culture is good. Still, there are 30%, which I see it's very high, feel it's not good environment to speak up.
Okay.
In some countries, the patient safety culture is lower than this. In some hospitals, very low. Being realistic, facing the issue, knowing it's complicated, speak with the frontliners, don't punish them, make safety culture is very important. Do you know if this patient, after what happened, they start to ask her, why did you didn't speak up? Can you make a link between the two incidents that I told you, between the nurse who gave the wrong blood and between the nurse who didn't speak up?
Basically, both of them have put the person above them as the authority, meaning no ways would I be correct above them. So having
Exactly.
said that, they constantly, even though they know that they're right, because obviously even the nurse who would have said, I know I saw the patient fall, and chances are if I mention this, we can act immediately. But out of fear, she withheld giving information because she didn't think that her voice would be heard.
That's a part, or maybe if I'm going to say they're going to punish me.
Oh, yes, that's true as well. That's very true as well.
Yes. So I won't speak up. How because of not saying it immediately, there had the complications to the patient. And by the way, this is the things that is catched. There's a lot of other things that may not be catched. For that, when the hospitals making an incident reporting, we encourage them to make it anonymous so everyone can make an incident reporting. But the good part is to be a brave, not be a brave. Everyone is a brave. Is to put his name, making sure that they will not punish me. I need to tell you there is something here wrong. I can face it. I know that you are not going to punish me. So please hear me, listen to me. There's something wrong. The administration, the C-suite, the CEO, and all this stuff, they see what's happening by the eyes of the frontliners. They are the one on the ground who tell them what's happening here, what's happening there, what should be improved. For that, I'm telling you, the strategy that should be followed to sit with them, listen what's happening. I know some facilities, they have more than 5,000 staff. They cannot sit with them. However, here of the quality and patient safety, they can see the incidents. They can encourage the staff to put more incidents. And then based on these incidents, they can analyze it and see where is the gap and work with the C-suite to improve it.